A very warm good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. Wilson sir. So today's topic will be regarding the scope of Siddha medicine and significance of research medicine in Siddha, challenges and way forward. And regarding sir is a research officer in Siddha, scientist, second level, and Central Council for Research in Siddha, Chennai, Tamilnadu. We welcome you, sir. We welcome all the participants to the today's session, and the session is hand over to sir. Yes, sir. Please continue, sir. Dr. Wilson, sir. Yes, sir.
Yes, I'm just sharing the screen once again. Is the screen visible now?
Yes, sir.
Yes, sir. Yes, sir.
Okay. Good evening, one and all. I first of all congratulate the AIHSAYA team for organizing this web series. And on the occasion of the 12th Ayush Vinyan Sammelan 2K25, I am happy to share about Siddha system of medicine. And I thank, in this regard, I thank Dr. Varanasi Roja, research officer, scientist 4 from Central Council for Research in Homeopathy. And I also thank Dr. Lavanya for facilitating me to participate in this event. So the outline of my talk would be about the introduction of Siddha system of medicine, scope of Siddha system of medicine, significance of research, challenges and way forward. So this would be a brief outline. And to the young students, I would like to tell that your devotion and care bring healing and comfort and hope. So it's an unknown quote, but doctors are revered as gods in our country. So it's just a matter of our devotion. So this is a quote I want to share. This is a quote I want to share, which is published by the technology think tank, Department of Science and Technology, Ministry of Science and Technology. So in 2000 BC, they said that eat this root. And in 1000 AD, they started to say that root is heathen, that is uncivilized practice. Say this prayer. And in 1865 AD, they said that prayer is a superstition. It's just a belief. And drink this potion. Potion is nothing but decoction. And in 1935 AD, they started saying that potion is bad. Swallow this pill. And in 1975 AD, they said that that pill is ineffective. Here, take this antibiotic. And 2000 AD, they are back to square one that by saying that antibiotic is poison. Here, eat this root. We all know how much there's antimicrobial resistance in our society. So it's difficult to treat any infections. People don't even respond to simple antibiotics. So that much is the overburden of antimicrobial resistance. And not only that, pediatricians now are very cautious. Earlier, they used to write left and right antibiotics. Now they, even after 3 days of use only, they start writing antibiotics after confirming that it's a bacterial infection. And the way of practice that our diet also has changed. Even people are afraid to take broiler chickens because it's fed with antibiotics. So a lot of things are, and we are back to our traditional practices. And the technology think tank, Ministry of Science and Technology, emphasizes the importance of traditional medicine in this way. And we all know that the World Health Organization has established the Global Center for Traditional Medicine in India. So now the second global summit is going to happen on traditional medicine is going to happen in 17th to 19th December. So the World Health Organization and the Government of India together are going to have the WHO Global Health Summit, which will be attended by the health ministers of different countries. So overall, when you see that 170 member states, that means member countries out of 194 countries, the 170 WHO member countries acknowledge their use of traditional and complementary medicine since 2018. So that is the impact or the scope of traditional medicines. And recently, the World Health Organization has published the international standard terminologies on Siddha medicine. So there is recognition for the traditional medical systems. That's what I want to emphasize. So this document is available from the link which I have given. So if you can also get it from typing in Google, and it's an this document is a universally accepted interface between modern biomedicine and the time-tested healthcare practices of traditional medicine. So in this way, the terminologies are accepted by the universal health community. And you see here the ICD-11, International Classification of Diseases 11. After so many sophisticated instrumentations, so many biomarkers, and after now we have entered into the AI diagnosis also. We have lot of diseases which the cause is idiopathic. It is just a sample list, and the cause is unknown. Idiopathic means that cause is unknown. So many diseases we still don't have the exact cause. So we can treat it only in a symptomatic way. But whereas in traditional system of medicine, we can identify the subtle changes which occur in the body through our Siddha system of medicine or any traditional medicine, for that matter, even homeopathy. Through our science, we can identify the subtle changes that happen in the body, and we can address the problem. So the World Health Organization has published the ICD-11 Traditional Medicine Chapter Module 2. So Module 1 is traditional Chinese, Korean, and Japanese medicine published together. And traditional medicine chapter module 2 is Ayurveda, Siddha, and Unani published together as ICD-11. So this ICD-11 is utilities is lot. So it can help to assess the public health cause of death, clinical records, surveillance, primary care prevention and research. So there are a lot of uses regarding this ICD-11 traditional medicine chapter 2 has already been published. And Siddha, we are yet to publish the benchmarks for training and practice, but we are working with the WHO and it will be published shortly. So these are all of the things which are happening now, and I'm happy to convey the developments taking place. So the broad definition of traditional medicine is given here. As you all know, traditional medicine refers to health practices, approaches, knowledge, and beliefs incorporating plant, animal, and mineral-based medicines, spiritual therapies, manual techniques, and exercises. They can be applied singularly or in combination to treat, diagnose, as well as prevent illness and maintain well-being. So this is the broad definition of traditional medicine. And these are all many forms of the traditional medicine. And the most latest field we have this is the integrative medicine. It's the practice that combines conventional medicine with complementary and alternative therapies. And Siddha, Ayurveda, Unani, homeopathy, they are all whole medical systems which are complete systems of theory and practice that have evolved over time in various cultures. And we also have this manipulative and body-based practices. So in Siddha system of medicine, we have this therapy called Varmam therapy. So where we touch the patient's vital points and manipulate. And energy medicines involves the use of various energy fields as well as mind-body medicine. So it depends on the pranayama meditation techniques, where we use a variety of techniques to enhance the mind's ability to affect bodily function and symptoms. So this is used for mind body medicine is very much popular. If you type mind body medicine, you will get a whole lot of links, and it's very popular in the West, as you all know. And it is very helpful to treat the psychosomatic illness. And you are also aware of the many natural products that are booming in the market. So these are some of the medicinal placed products sold over the country in developed countries. So these are some of the lists you can go through. I will share the PPT so that it will be useful for you. And these are some of the medicinal plant-based products sold in developing countries. So even Digitalis, Chennosites, it's a very laxative, good laxative from Chenna species. So the list goes on. And you all know about the willow bark tree, that is aspirin, Salix alba plant. So it's a widely used plant, and snake root, Ravolfia serpentina, where we get reserpine. It is used for hypertension. We have tablet forms, and aloe vera. You all know it has various glycosides. It's used for burns, and it has a many usage in the cosmetic arena. And Vingristin and Vinblastin from Vinca rosea. So it's used for leukemia, and Taxus species, where we get Taxol, and it's used for ovarian breast cancer. So these are some of the examples. And at the same time, I want to highlight the adverse effects of biomedicine. So he's none other than Dr. B.M. Hegde, the renowned cardiologist and vice chancellor of Manipal University. He's retired now. He says that the flaw of today's approach to treatment is that human body is seen as a car machine which can be repaired part by part, whereas the human body is a whole entity and should be treated in entirety. So how else can one explain the side effect of drugs used to treat one organ affecting the other organ, he asks. So this is what our traditional medicine does. We treat the body as a whole, as in entirety we treat. And whereas the system, because our medicine, it doesn't even goes to the liver. It gets digested in the abdomen and the stomach, and it gets absorbed in the bloodstream. Whereas the other modern system of medicine, they cross the liver, and a lot of side effects. If you start taking drug, statin drug, it leads to, after 1 or 2 years, the patient eventually becomes a diabetic. So lot of side effects are happening. And he says the pharmaceutical industry does not create cures, it creates customers, because they have in the modern many, even many me- uh, drug companies, they doctor the medical report even for during cancer trials. So they have the stakes in the in the form of uh, uh, shares in the pharmaceutical industry, and they try to promote that product. So you will very well understand that the pharmaceutical industry does not create cures, it creates customers. So coming to the scope of Siddha system of medicine, so India is presently now is the first populated nation. It's not the second largest populated nation. We have overtaken China, so it's just a typo error. And India is approximately a combined population of 6 countries, namely USA, Indonesia, Brazil, Pakistan, Bangladesh, and Japan. So, with the large human resource database comes many inherent challenges. So, India is having the dual burden of diseases, where on the lower end we have the malnutrition, hygiene related issues, immunization, sanitation, and infectious diseases are the major concerns. And on the higher end, we have the environmental health and lifestyle diseases and other non-communicable diseases have raised alarm. So, in other words, we can say that India is facing a triple burden of diseases. So, unfinished agenda of communicable diseases. Even the December 1st, we observed the HIV/AIDS Day, and still it's a go. India is facing the burden. New cases are arise in the northeastern states, and still we have the multi-drug resistant tuberculosis. So it's a very great burden. And India had a target to eliminate TB in 2025, but they are yet to. Now they have shifted the target to 2030. So, and we have the non-communicable diseases. So, 4 diseases, namely heart disease, cancer, diabetes, and chronic pulmonary diseases, contribute nearly 80% of the all the deaths. So, you can ask your parents, or you would be if you're a physician, you would be aware that most of the deaths occur due to these 80%. So in out of 10, 8 people die of these diseases, and they share 4 common risk factors, namely tobacco use, harmful use of alcohol, unhealthy diet, and lack of physical activities. So the role of traditional physician, or a Siddha or a homeopathy physician, is uh, that of he should have the wear the hat of a counselor. So, so they 80% of the deaths can be prevented if we address these 4 issues. We should counsel the patient not to use tobacco, not to use alcohol, and advise them a healthy diet, and how to have a healthy activities. So, if we can counsel the patient in these 4 areas, we can prevent 80% of the deaths. So, the role of a traditional medicine practitioner is very vital. And we have all crossed COVID, which is a very huge which was a very huge pain to us. So this is one of the case studies I was to present. This is the normal anatomy CT of a brain, where we have the normal anatomy on one side, on the left side, and the normal sized ventricles on the right side, which is marked in red color. So if it is enlarged, it is called ventriculomegaly. So, an antenatal case with intrauterine left lateral ventriculomegaly was suggested to undergo medical termination. But the parents were very curious to have the baby. So, they started on a Siddha medication, and after 3 months, the reports came with no dilatation. So, even in intrauterine life, our traditional medicines do wonders. It's a medical miracle. So the parents were so happy that their coitus is saved by Siddha medicine. So this is the ultrasound report before treatment, and this is the after treatment. So another example in cardiovascular diseases. So the physiological function is assessed by ejection fraction. So we know that if it is above 760 or 70, the patient has a normal ejection fraction. So they, if it is less than 40 or 30, it's possible heart failure is there. So in many patients where we cannot do the vessel walls are weak, where they cannot do coronary bypass surgery, we can try the Siddha medicines or the traditional system of medicine. See, in the on the left side, the ejection fraction of the patient treated by me is 22%, and whereas in the right side, the image, the ejection fraction has improved to 52%, only by Siddha medication. So it's safe and internal safe drug which improves the function of the heart. So the patient is earlier could not climb stairs. He would have a discomfort and pain in the chest. But now, with the improvement in the ejection fractions, they are able to lead a normal life. So even in see, this is the drug which was used for the earlier case study, and even the mortality rate in patients who have undergone CABG surgeries was 6.2, and patients another study reported that the mortality rate is 10% with the CABG alone or combined with valve replacement. So, as I said about Dr. Hegde, Dr. B.M. Hegde, so he did a study when he was a cardiologist, and he had two groups of patients. For one group of patients, they were anesthetized, taken to the operation theater. They were not operated. They were not operated. Uh, CABG procedure was not done. Bypass surgery was not done. They brought back them to the ward. And in the second group of patients who was anesthetized, CABG done, and they were brought. And when they compared both groups, the mortality rate was high in the patients who had undergone CABG. So he says that the body will form the collaterals which will help the patient to regain the circulation. But patients who undergone CABG, the mortality rate was high. So another alarming factor, he says, in countries where people do where doctors go on mass strike, the mortality rate reduced, he says. When in many countries, this information is published in JAMA article. So you can also refer to stocks and verify the JAMA article, what it quotes. So in countries where doctors go on mass strike, the mortality rate should rise because there are no hospitals. But the mortality rate reduced, he says. So many are hospital acquired infections, and needless procedures they do, and the death rate naturally increases. So this is what he tries to say. So, to the young students, the chapter you are learning today is going to save someone's life tomorrow. So, pay attention. This is for young students. So, this now we are coming to the introduction of Siddha medicine. So, the poem is taken from Tirumular Tirumandram, a treatise authored by Saint Tirumular or Siddha Tirumular. He says that Marupadu Udal Noi Marundanalagam. That means one that cures physical ailment is medicine. And Marupadu Ulanoi Marundanal Shalum. So one that cures psychological ailment is medicine. Marupadu Noye Marundanalame. So one that prevents ailment is medicine. And Marupadu Savai Marundanalame. So one that bestows immortality is medicine. So this is the definition of Siddha medicine given by Saint Siddha Tirumular. So the root word is taken from the word Siddhi, which means an object to be attained or perfection. So the practitioners of Siddha medicine aimed at perfection of health. So it was developed by Tamil sages called Siddhas. So through the physical health, one can attain the eternal bliss. That was their goal. So all the five components: physical well-being, mental well-being, emotional well-being, social well-being, and spiritual well-being are important. And through Siddha medicine, the goal is to attain the eternal bliss. So this was the objective of them finding the Siddha medicine. So significance of Siddha medicine. So prime importance is to treat the underlying cause. So as I told in the introduction itself, so many latest PET scans are there, many markers are there, but still many diseases are idiopathic. The patient has the problem. The reports are normal, but the patient is the end sufferer. But through our system, traditional wisdom, we can address the underlying cause, which is subtle in nature. And earlier, it was a notion that traditional medicines are only used to treat chronic diseases, but like arthritis or skin disorders. But now, after COVID, we can do a lot in primary health care. For example, a fever or a diarrhea or an acute headache, or we are able to treat lot of acute diseases. And the most important concept is now the world is towards pharmacogenomics. So based on the genomic nature, they try to treat. But uh, long ago, we had this individualized tailor-made approach. So based on the phenotype and the constitution of the individual, we have the individualized tailor-made approach, and we have many adjuvant for the Siddha medicines can be administered with even modern biomedicine. So integrative medicine is very easily can be done, and emphasis on diet and lifestyle management. As I said, 80% of the diseases can be prevented if we emphasize on diet and lifestyle management. And we also have drugs with longer shelf life. So the pulse we take generally, it's a very important aspect we uh, diagnose for use for diagnosis. So we see the direction of the pulse. Normally, the direction of the pulse should be towards the thumb and not towards the elbow. So that is one point. And the ratio. So we have ratio. The first middle finger denotes adult or fire. The first the ring finger is used to denote phlegm or cold, and the uh, uh, index finger is used to denote worry or wind. So the ratio is given as 4 is to 2 is to 1. So this is the normal ratio. So it varies according to the time and our habits. So, but the physician will be trained to assess the ratio upon the time when the patient visits the clinic, and accordingly diagnose the disease. And the movement of the uh, pulse is also compared to, like if the pulse moves like a snake or frog or a hen, so the movement matters. So when you feel the pulse, we able to understand which movement is like and compare it, and based on that we can diagnose the diseases and the location. So in a finger which touches, so see this three points are divided into so many 39 points. So where we can feel the pulse is very much important. So just one case study which my friend treated, Dr. Balamurugan. So I acknowledge him for this. And this is one case study. So a patient, a middle-aged woman, she came with complaints of sinusitis. So there was no reason to go for an FNAC. But based on the nadi pulse of the patient, my Siddha physician insisted to do an FNAC. So FNAC showed only eosinophilic material and occasionally inflammatory cells. So the report came as no evidence of malignancy in the material. And the Siddha physician was not convinced. He forced the patient to do a PET scan. So PET scan, the report came as metabolically active irregular enhancing lesion in the lower and outer quadrant of the lymph nodes. So malignant lesion it came, and since it was the first stage of the cancer, she was advised mastectomy, and the histopathology of the removed tissue showed invasive lobular carcinoma grade 1. So even grade 1 cancers can be picked up by Siddha pulse diagnosis. So this is the importance of the patient did not come any problem in the breast. She came for sinusitis. But based on the her pulse, we were able to pick up this patient early and treat, and now the patient is very comfortable. So that is the strength of Siddha system of medicine. So oil, spread pattern of gingerly oil. So this is a test which is usually done in patient's urine. We drop 1 drop of gingerly oil in the patient's urine, and we observe the spread pattern. So with that, we can able to identify which primary humor is affected. So we have 3 humors: Vadi, Adal, Ayam. So wind, fire, and phlegm humors we have. So which humor is affected, we will be able to diagnose, and that not only helps in the diagnosis, it also helps in the prognosis of the disease, whether the patient is responding to the treatment or not. So even we had Kabasura tablets available in Tata 1mg and Apollo pharmacies. So we did a double-blind study in GIMS Noida, so Government Institute of Medical Sciences Noida. So where we did a placebo control trial. So for the placebo, we gave decaffeinated tea, and to one group we gave Kabasura which is a decoction made of 15 ingredients, and another decoction is Nilavembu Kudini. It's a decoction comprising 9 ingredients. So this study just published in Trials Journal. The study results. This is the protocol which was also published, and which showed that Kapasura Kunni has very good effect. So even the guidelines for Siddha practitioners for COVID-19 was published by the Ministry of Ayush Government of India. So even we have this Nilavembu Kudini, that is Andrographis paniculata decoction for chikungunya and dengue epidemics. It's very effective. So this is the Ministry of Ayush advisory which was published for COVID-19. And this is the advisory which was published by the Tamilnadu government also, which was used in the state. We had Siddha COVID care centers. So around 95 centers where lakh population was exclusively after the triage. Patients who are willing, mild patients, moderate patients who are willing to take traditional medicine, they were sent to Siddha COVID care centers. So only Siddha treatment and diet was given, and they improved, and there were no deaths in the Siddha exclusive COVID care centers. So now we are looking at P4 medicines: predictive, preventive, participatory, and personalized. So individualized, tailor-made medicines is gaining momentum, and we have this assessment of body constitution app designed by our Central Council for Research in Siddha. So we try to identify which constitution the patient falls into, and we tailor make the treatment plan. So this is how we go about, and this is about integrative medicine. So we have a formulation called Tirigadu Churnam. So it is prepared from dried ginger, that is Gingivera officinale, pepper, Piper nigrum, and long pepper, Piper longum. So from this Tirigadu Churnam, if you get piperine, so with that, if you add rifampicin, see the magic. So Resorin, it's a fixed dose combination of rifampicin, isoniazid, and piperine, resulting in decrease of rifampicin dose from 450 milligram to 200 milligram. So see, up to 50% the dose of the modern drug can be reduced. Just 10 mg of piperine, it's a bioenhancer which makes the difference, with 60% improvement in its bioavailability. So if a drug is said to be given intravenously, we say that it is 100% bioavailable. Whatever oral drugs we take, there will be bioavailability of 80 or 85% maximum, or even 60% for some drugs. So This piperine can enhance the bioavailability to 60%. So this is the article published in the International Journal of Applied and Basic Medical Research, where piperine was found to increase the bioavailability of various drugs from 30 to 200%. So that much of potential the Siddha medicine has for integrative medicine too. So as I said, our the science, Siddha science is based on pre-humor theory. So humor means any fluid or semi-fluid substance in the body. So to regulate the living body easily, we have the five basic primordial elements known as Panchabhudam, which are combined into three humors. So it's wind or air humor, fire or adal humor, cold or phlegm humor. It's called ayam. So when humors are in natural equilibrium and harmony, a person enjoys the best of health. So derangement of imbalance of three humors leads to disease. So abnormal state can manifest as excess or deficiency of humors, and the pathological state of humors are called three doshas or mukutram. So coming to pharmacology, so in Siddha medicines, by default, drug itself denotes centered root or leaf. So primary, our weapon is plant-based medicines. In addition, we also use mineral-based, even metal-based products, and also animal byproducts. So we select and administer drugs basis on the property based on five elements. So, and we have this five properties when choosing a formulation. So the taste, potency, post-digestive effect, character, as well as individual biological action. So taste, we have six tastes, which the combination of two elements combine these taste, six tastes. So just for a easy understanding, I have given some examples. And each taste can aggravate and pacify the putram or the dosham or the disease state, pathological state. So for example, if you have the IM or the phlegm humor, it increases if you take sweet, sour or salt. That's why if a patient is suffering from cold or cough, we ask them to refrain from taking the sweet taste. Instead, for if a patient has suffering from a cold, common cold, a spicy hot soup will be pungent soup would be able to alleviate the problem. So likewise, for each humor, there are tastes which aggravate the humor and the tastes which reduce the humor, pacify that. So so here is one example. So which I said for the common cold. So sweet receptor is activated by amino acids secreted by specific bacteria. So when that's why we say so how the traditional medicine and modern medicine can be correlated. So it blocks the release of antimicrobial proteins. So that's why our siddhas have said so during cold or cough to avoid sweet taste. But whereas bitter taste, if you take it releases bitter or pungent taste, it can release the antimicrobial proteins, thereby bringing about a relief. So we have the second brain that is known as the gut. So intestinal flora as a potential strategy to fight SARS-CoV-2 infection. So we all know this new theory, gut microbiota is very much emphasized in Siddha medicine. So this biosis state can lead to a lot of diseases, starting from fever. It can lead to a lot of diseases. So functional foods are advised, prebiotics, probiotics, or a combination of prebiotics and probiotics, that is symbiotic, are now emphasized. So as I said earlier, mind-body medicine. So a number of US medical schools now have departments devoted to mind-body research. So we now even ask the patients to have a mindful eating to reduce the stress. And this six dynamic centers which are mentioned in Siddha system: Muladharam, Swadhitanam, Manipuragam, Anadagam, Visuddhi, Akine. So these serve as dynamic centers which function as nerve plexus, and this is useful for psychosomatic disease. So six basic centers of the subtle body are chakras. So these are very much used for mind-body medicine and psychosomatic disease. So the solution for psychosomatic illness, as per according to Siddha, is right living begins with right thinking. So we have these four andhakaranams, that is mind, intellect, coordination, and accomplishment. So the from the start, the thinking matters, which leads to right living, which can be corrected by our counseling to the patients. So special therapies, we have Varma manual therapy, I told you. We have special massage techniques, breathing exercise, pranayamam, kaya karpam, regeneration techniques. We have bone setting therapy. So one of my current seniors, he's in Kallakurchi in Tamilnadu near Salem. He nearly treats 120 patients, only bone setting. So he specialized in that. And one Dr. Wilson in Pollachi, he is there in Tamil Nadu. So he is also a qualified Siddha graduate who's doing this bone setting therapy. They are trained to do that. And Suttige, cauterization with therapies we have. And for anorectal conditions, we use this caustic therapy or Karanol Chikichai. So this is during the one of the training programs in Germany, which I attended for Varmam and Tokunam, teaching the participants. And these are guidelines for practice of Siddha Varmam therapy, where we use the pressure points to manipulate. And these are the Prodi Tirumudal or Tokunam massage techniques. So we apply powders and do the massage. And here in the right side, we use oil and use it. So the role of Siddha medicine, it can be preventive, promotive, curative, palliative, and rehabilitative. So palliative is also important. So the family, the caregiver, if we can bring about a 10% improvement for a CP patient, cerebral palsy patient, or an autism patient, or an ADHD child, that is more than enough for the caregiver. So if the neck control we can bring about, or we can stop the dribbling of saliva, we can reduce their hyperactiveness or their aggressive behavior. So that makes a lot of difference in the life of the caregivers also. So rehabilitative services also very much important in Siddha. And the Disabilities Act covered under the is only 5 or 6 we know: blindness, low vision, leprosy. But there are many illness where Siddha can play a role, even for Parkinson disease, neurological conditions, specific disabilities, multiple sclerosis, so cerebral palsy, muscular dystrophy. So these are a lot of areas where Siddha can have a very good approach to rehabilitate the patient. So there was a study done by a group of researchers in Canada. So they studied the Siddha Tanga Parpam, and they concluded that it can be used as a drug delivery vehicle, improving the chemotherapy of certain drugs and enhancing the capacity of anti-cancer drugs to destroy the targeted cells, because they were able to penetrate the nucleus of human cancer cells. So this was the study done in Canada using Siddha Tanga Parpam. So for cancers also there is a scope. So medicinal leeches in June 2024. So the FDA has cleared the as leeches as medicinal devices. So the lot of the leech saliva contains so many chemicals, and it is very valuable as the first line of therapy for musculoskeletal disorders and venous insufficiency. Shall I stop because the time is up?
Sir, you can continue, sir.
Not an issue.
Okay. So for drug of choice for type 2 diabetes, we have a very good formulation, polycouple formulation. It consists of 8 drugs. So this formulation is known as Avare Kudinir Churnam. So the benefit of having this Avare Kudinir Churnam is that it can uh, reduce the failure of oral hypoglycemic agents. So when the patients get started with metformin, the first line of therapy in allopathy, for example, after 2 years or 3 years, they increase the dosage, then they add the second drug, third drug, fourth drug, and finally the patient goes to have the insulin. They become insulin dependent. But when we have a patient for integrative therapy, where the patient with 500 milligram metformin BD dosage, PAD dosage, and this decoction, patient can live comfortably for 25 years, 30 years, no problem, without complications, uh, because their blood sugars and HbA1c are in control. So the failure of oral hypoglycemic agents is controlled by this medication, which is very effective. So this another public health initiative known as Amma Magaperi Sanjeevi Kit. So where in the first semester we give some uh, um, 3 drugs. Madalai Manapaga is nothing but preparation prepared of pomegranate, and Karupala is nothing but curry leaves to counter morning sickness and improve digestion, and as well as the iron deficiency. And the second trimester we give Siddha ferrous sulfate tablets, that is Anambedi Chenduram, Nellikai legume, which is made of Indian gooseberry, and Eladi Churnam, Elateria cardamom. So to improve the digestion, vitamin level, as well as the anemia status. And the third trimester we use this Ulundu Moong Dal Thailam and Kundriga Thailam. So to help ease the delivery passage. And the second and third semester we give the trimester we give this Pavana Panjamula Thailam to induce normal delivery, as well as during postnatal period we give Sadavari legume, which acts as a galactogog, enhancing the milk secretion, and the Pinda Thailam for pain management to prevent back pain, as well as for the infants. Urai Matra, it's an immune booster. So it's a very good package. If this is administered throughout our country, it will I'm sure that it will reduce the maternal mortality rate, MMR, and the infant mortality rate, IMR. Both it can reduce to a great extent. So such a combination, which is carefully designed, and it's very, because even we find many women even in the urban areas are anemic due to the monthly cycle. So this is a very good combination. And even for growth stunting, we have a lot of preparations, and this is a formulation known as Panjamutti Kanji. So this is a porridge which is used in Siddha system of medicine. So it see 1 in 2 children are stunted, their height is reduced, and we can also use many semi-solid dosage forms like jams, ashwagandhi legume, which are made of Phitania somnifera, and Nellikai legume. So Indian gooseberry, these can be given. So significance of research. So research phases in drug trials and AIH, there are before, for the significance of research, you have to understand this point. So from screening of chemical substances, the modern Western medicine follows this phase. So starting from in silico, in vitro, in vivo studies, they go to the phase 1, phase 2, phase 3 trials and clinical practice. Whereas on the right side, we find the AYUSH system of medicine. So where these medicines are used in clinical practice, and we try to understand the context, the philosophical understanding. We go to the safety status. We do the comparative effectiveness, component efficacy, and the biological mechanism. So this is the route which Ayush takes, the second one which I told. So difference between research in conventional medicine and Ayush is evaluation is done before wide availability in modern biomedicine. We do only evaluation if we are frequently using it. For example, in COVID-19, many medicines were evaluated. So standards are often available in conventional medicine, but here we have diversified, individualized standards, and academic research structure is very robust in conventional medicine. We are improving. For in say Ayush, after the central government establishment of ministry in 2014, separate Ayush ministry, the academic structure is improved a lot. And the only major difference is the public and industry funding is wide in conventional medicine, whereas the industry funding is very less for us, and the research motivation is improvement, whereas research motivation is justification in case of Ayush systems of medicine. So this is the phase of clinical trials where it takes a 7 to 10 years minimum for a drug development. So we have this phase 1 trials, phase 2, phase 3, and post-marketing surveillance, otherwise known as phase 4. So phase 1 is we do it in healthy volunteers, and phase 2 we do the efficacy, and in phase 3 we do the confirmation studies. So this is another formulations for Madhumega Churnam, which is used for diabetes. It was done in Ramachandra Medical College, where we had a very good effect. See the statistically HbA1c values were significant. So this is also a cohort study, which is a study sponsored by the Department of DST, sponsored this study, and Siddha medicine was useful. So this is another formulation where cantharidin blisters were used for lumbar spinal stenosis. So see from 7.2 the pain score, VA visual analog scale, it reduced a lot to around 2. So and the use of analgesics were higher in the control group. Waiting list control was used, and no serious effects were observed. And this is another study for pleuropneumonia and thoracic pain syndrome using cantharidin blister, which was also effective. And this is a RAN therapy which was used during the HIV pandemic. So 3 drugs were used, that is RAN, secondary medical. It's a combination drug, a herbometallic drug with 48 ingredients, and Amukra Churnam is nothing but Titania somnifera, and it's a polyable formulation containing 8 drugs. And Nellika elegum, our Indian gooseberry, Chavana Prakash, it is also used in the name of Chavana Prakash in Ayurveda. So where we could observe clinical improvement and elevation of CD4 counts and CD count, increase in 5 patients of 11 patients. So it's small sample size. So but as a public health initiative, we could see a huge change with this regimen, which was given in TB Sanatorium Hospital in Chennai, and as well as many NGOs started giving this, and a marked prognosis was formed. So this is some of the medicated oils which is used in Siddha for psoriasis. So Matan Tailam for even diabetic patients, for wound healing we use it, and Arakadi Tailam for pain syndromes we use it. So powder dosage forms, we have this Sangaparpam, it's a best antacid used in Siddha system of medicine. So challenges and way forward, this is the hierarchy of evidence-based medicine. So starting from animal and laboratory studies, we go on to the case reports or case series, followed by case control studies, SWOT studies, RCTs, and which is followed by meta-analysis and systemic review and clinical practice guidelines for the standard treatment guidelines. So this is the infrastructure of CCRS. We have 9 peripheral institutes located all over the country, and we are into clinical research, drug research, literary research, nutraceutical research, and ethnobotanical research. So this is the official Siddha Pharmacopoeia of India, as well as we have the Siddha Formulary of India, which are officially recognized formulations. So many startup initiatives and schemes are available in CCRS. You can see the CCRS website, and there are many avenues for students for research and education. So this is the GCP guidelines for ASU drugs published in the year 2013 by the Ministry of Ayush. So, and research planning, first is the we have the PICOT formula to frame the research question. So P is for patients, I is for intervention, C is for control group and outcome. So based on this, you can have your research question and hypothesis. So if you are clear with this, you can design a proposal and carry out it. So challenges in Siddha, we have the many challenges. So as listed, language barrier is one issue. Many drugs are mentioned as in secretive nature. So a lack of many scientific data is one pending, which all traditional systems face, and pharmacodynamics and pharmacokinetics also we are lacking. So way forward using is a reverse pharmacology. As we use the reverse pharmacology approach, we should do the research up to the mechanisms of action, and it should be published in peer-reviewed international journals. So we should also start hitting primary needs of the patient, acute conditions. That's what I told all the introduction part also. So we should be able to, because many people throng the modern hospital just for fever, cold, but whereas we have good solutions in traditions and traditional medicine. So integrative medicine is the need of the hour. So this strategy will bring about a paradigm shift in realizing the potential of oil streams, especially Siddha system of medicine. So we should translate our research outcomes from bench to bedside for the benefit of public. So as a conclusion, so diagnosis is always the key, because during COVID we had lot of information coming in YouTube, because many started to self-promote themselves. But as a physicians, diagnosis is the key. So one size fits all approach should be used with caution, as in case of COVID, because every patient was behaving differently in case of COVID. So one patient, the virus affected the GIT, one patient it affected the heart, one patient it was neurological complications, one patient it affected the hemopoietic system, so on and so forth. So each patient was unique. So one size fits all approach should be used in caution. And Siddha medicine is a unique blend of therapies which provides holistic care, offering advice for a more natural, healthy lifestyle. So equip yourselves, have empathy, and you will be an effective and successful practitioner. So thank you for this opportunity.
Thank you, sir. Thank you, sir, for the extensive and in detail research.
Any questions? I can take one or two.
Yes, sir. Sir, actually, basically, I do have a question, sir. How about the usage of black
About
curcuma longa in Siddha medicine, sir?
curcuma longa.
Yes, sir. Black curcuma longa, sir. Not yellow curcuma longa. Black curcuma longa. Curcuma cassia.
Okay. Um, um, that is also used in our literature, and we for skin disorders we primarily use that, and it's a part of the one of the ingredients in the traditional formulations. So it is also widely used in synthesis form medicine.
Sir, how about it usage for the cancer patients?
Um,
Any limit?
So we have not
Pressure
done
available.
we have not done any studies on that. Especially, we have not done studies on that especially. So we should take it now only after this DG has come. We are working towards cancer proposals. So we are having treating it in the OPD level using in All India Institute of Ayurveda. We have the cancer OPD, and in AIMS New Delhi also we have the cancer OPD, and in Safdarjung Hospital also in Delhi we have the cancer OPD. So we are treating patients, but not with this formulation. So we have to evaluate its usage before it is used for these cancer conditions.
Acha, acha. Sir, generally in which form it is used, sir? In generally to get the knowledge, I am asking, sir. Generally,
So,
the black curcumalonga in which form has been used in?
medicated powder or decoction. Medicated powder, churnam or decoction.
Oh, okay, okay, sir. Thank you, sir. Thank you so much.
So thank
Any
you.
other questions from the participants?
सर मेरा कुछ क्वेश्चन था डॉक्टर लवन मैम थोड़ा आप कॉन्वे कर देना मेरा मैसेज सर को
हाँ जी सर, जी सर.
सर
Can you
WHO जो
repeat the question in
जो
English?
प्रोजेक्ट चल रहा है आपका सिद्धू में तो उसके बारे में अभी अभी ना आपका नॉर्थ ईस्ट इंडिया में जैसे कोलकाता बिहार यहाँ पे आपका रिसर्च सेंटर है सर सिद्धा का
No, Gauhati. We are will be
कोलकाता
inaugurating it shortly. Gauhati, there is a proposal. So the Ministry of Ayush has already approved. The construction is being is on with the CCRH, Central Council for Research in Homeopathy, looking after the construction work. And after the construction work, CCRS will be initiating opening the Siddha Clinical Research Unit in Guwahati. Certain. It is in pipeline. It is in pipeline. It will come in Guwahati.
एक्चुअली क्या ना गुवाहाटी में घर घर होम पे गुवाहाटी में आपका नेचुरल सोर्स बहुत है आरोखा का जो ट्रेडिशनल सिस्टम ऑफ मेडिसिन है गुवाहाटी में है सिक्किम में है गैंगटॉक सिक्किम में है और अरुणाचल प्रदेश में है नॉर्थ ईस्ट इंडिया में बहुत सारे ट्रेडिशनल मेडिसिन है तो वो लोग को हम लोग कैसे आयुष का अंडर में लेके आ सकते हैं उसके ऊपर हम लोग कैसे रिसर्च ऐसे हो सकते हैं कभी कभी वो लोग का क्या ना वो लोग होम्योपैथी आयुष को सब इंडियन सिस्टम ऑफ मेडिसिन वो लोग ट्रीटमेंट कर रहा है
Yes, there is lot of scope. There is lot of scope. So after these centers, we can also do ethnobotanical surveys. We can analyze the claims of the practitioners, and that we will be able to do after only establishing the unit there. So Ayush has lot of scope there, and okay.
यस सर क्योंकि सीसीआरएस सेंट्रल रिसर्च सेंटर सीसीआरएस वर्किंग विद द ब्यूरो ऑफ द इंडियन स्टैंडर्ड बीआईएस to develop standards for the
Yeah.
Siddha raw materials and formulation the WH the World Health Organization project.
Yeah, it's our doctor. One doctor is Siddha research officer is posted at BAS, Bureau of Indian Standards, and we are also having a Siddha pharmacopoeia subcommittee. We're looking into the quality control of Siddha drugs. So they are in association with pharmacy pharmacopoeia commission of Indian medicine. We are also working. So we are looking into the quality control aspects, which is very vital, as you pointed out. It is very vital part. The safety and quality of the raw material of these Siddha medicines are very much important. And after quality control, only we should prescribe the medicines. So for the benefit of the patients, we are working with BAS as well as PCIM, and we have our council as our own Siddha Pharmacopoeia subcommittee, and we are working towards that.
सर हम लोग क्या नेक्स्ट टाइम पे नेक्स्ट वेबिनार सीरीज में हम लोग क्या अरेंज करते फार्माकोविजिलेंस इंपॉर्टेंस इन सिद्धा मेडिसिन जैसे फार्माकोविजिलेंस इंपॉर्टेंट इन आयुष मेडिसिन होता है ना सर फार्माकोविजिलेंस वेबिनार या
Pharmacovigilance also we have the pharmacovigilance units across the country, as we have also one in Delhi also, our pharmacovigilance unit is there. So we assess the casualty reports, whatever we says. The government has supporting the funds by appointing JRFs. So we assess the casualty assessment and we evaluate. We we observe all the claims. We challenge, re-challenge if needed, and we assess the impact of that in the patient. So we are documenting the pharmacovigilance aspects also.
सर सिद्धा के साथ इंडियन काउंसिल ऑफ मेडिकल रिसर्च आईसीआर का एक प्रोजेक्ट चल रहा है आईसीडी 11 में। तो सिद्धा का बहुत सारे नोट्स लिया गया है आईसीडी 11 में, इंडियन काउंसिल ऑफ मेडिकल रिसर्च आईसीएमआर।
ICD 11 we have worked with the WHO and published the traditional medicine module 2. So it's not by ICMR. The work was
2.0 Siddhi 2.0.
Yeah. Traditional medicine chapter 2. We work with WHO and it has already been published. Shortly, you'll be getting the links in the Google itself.
सर आपका जो पेशेंट था, कैंसर का पेशेंट था, जो ग्रेड 1 कैंसर, ब्रेस्ट कैंसर का था, जो मैसेक्टमी करेगा, तो सर उसका पेशेंट का टीएनएम कितना था? टीएनएम जो प्राइमरी लेवल में हम लोग डायग्नोसिस करते हैं कैंसर का, तो टीएनएम कितना, जो जिसने आपका बायोप्सी रिपोर्ट जो था आपके पास, जो आपने बायोप्सी प्रेजेंटेशन किया, हिस्टोपैथोलॉजी रिपोर्ट जो प्रेजेंटेशन किया, तो हिस्टोपैथोलॉजी रिपोर्ट जो आपने प्रेजेंटेशन उसमें टीएनएम नहीं लिखा था सर, जो आपने पेट सिस्टम दिखाया है।
The patient was absolutely was not showing any symptoms. That's only she did not complain. So TNF rating was 0 only at that time. But the patient, through diagnosis, through pulse diagnosis, he tried to he convinced the patient a lot, and he asked to go for PET scan. So through that only we are able to diagnose. Based on
नेक्स्ट सीसीएटी स्कैन अभी तक कंप्लीट नहीं हुआ, नेक्स्ट रिपोर्ट नहीं है, उसने नेक्स्ट टेस्ट सीरीज का नहीं किया अभी तक पेशेंट ने। और सर आपका वो फिगो इंटरनेशनल अमेरिकन इंस्टीट्यूट ऑफ ऑन्कोलॉजी सोसाइटी है, और जो फिगो है ना सर, फिगो के स्टेजिंग 1 पे हुआ ना?
Yes, the patient was treated. The patient was treated. Yeah, the patient was treated accordingly only. Accordingly only he was treated, because the surgery was done in Apollo hospitals. So the oncologist and the Siddha physician together, they devised a plan for the surgery. So accordingly only she was treated.
उसका मैसेक्टमी हो गया, राइट ब्रेस्ट कैंसर का, राइट ब्रेस्ट जो?
Yes, because in stage 1 it is often it is advised, the treating oncologist advised to go for mastectomy, because to save the life of the patient. So accordingly, with the help of oncologist only, we arrived at that decision, because keeping in mind the future of the patient. Now even after 20-25 years, the patient is well. This case study was done in 2000. So 20-25 years, the patient is still fine without any recurrence.
So थैंक यू सर। हम लोग तो प्राइमरी लेवल का भी सिद्धा के इंडेक्स दिख रहा है, अब स्टेप बाय स्टेप पार्ट 1 पार्ट 2 होगा आपके सब, तो बहुत अच्छा लगा सिद्धा का। एक्चुअली सर हम लोग चाहते हैं इंटीग्रेटेड सिस्टम ऑफ मेडिसिन में होम्योपैथी, आयुर्वेदा, सिद्धा, सबको जो कोई भी पेशेंट हो, जैसे आपने प्रेजेंटेशन दिया है डायबिटीज मेलिटस के डीएम के ऊपर, डॉक्टर लावन मैम का भी अच्छा सब्जेक्ट है डीएम, डायबिटीज मेलिटस, तो उस डीएम के लिए हम लोग होम्योपैथी, आयुर्वेदा किसको एक साथ इंटीग्रेटेड सिस्टम मेडिसिन ट्रीटमेंट कर सकते हैं?
We have to first integrate intra Ayush. We have to have studies using intra Ayush. I strongly support this claim. So our council should to come together, and we should use our strengths to combinedly treat a patient. Instead of Western medicine, we should first ourselves integrate among ourselves. So Ayurveda and Siddha can integrate, Ayurveda and homeopathy can integrate, Siddha and homeopathy can integrate, Siddha and Unani can integrate. So these type of studies should first come out. So whatever is good. See, traditional Chinese medicine, they are having a very good example. So they are widely integrating. First line, they give an option to the patient whether you want to take TCM, they can take whatever stage they want to take allopathy medicine, modern Western medicine, they are able to take. So that kind of uh, uh, approach should be there in our country. Then only it is good for our traditional medicine. So and for the patients, public at large. So the option should be given to the patients to integrate. So, but there are no combined this treatment approach, integrative approach in our systems. So, for example, homeopathy doctor and Siddha doctor and Ayurveda doctor should sit together and start treating the patient integratively. So, when that comes, only it is good for the patient and for our systems. That should happen. So, it should happen in the policy level. Policy
सर हम
level
लोग
decision.
पॉलिसी मेकर जो टीम है एनसीएस जो नेशनल कमीशन ऑफ होम्योपैथी है एनसीएच है सीसीआईएम में सेंट्रल काउंसिल इंडियन मेडिसिन है सीसीएम में सबको लेकर हम लोग गुजरात में इंटरनेशनल आयुष कॉन्फ्रेंस करना
But
चाहते
they are the policy makers now. Without policy making, we cannot do. But councils can do a lot. Councils should come, DGs can come together, and institutions, state government institutions, central government institutions, they should come together and work towards that. So if they do, we can achieve a lot. Can we wind up?
Yes, sir. Yes. Thank you,
Okay.
sir. Thank you first for clearing our doubts in detail. And we would like to have more sessions from you, sir. And we'll be glad that you have took your time and you have given us time to clear every doubt also. We'll be glad and gratitude for that. Thank you, sir. Thank you so much. So
Thank you. Thank you. Good day to all.
Goodness sir, thank you so much.
Thank you. Thank you. Shall I leave?
Yes, sir.
Thank you. Thank you.